Welcome to Care Nation TV Health. We aspire to be a source of prominent, professional, scientific-based health education news source for you. We are professionals and we want you to have the best information. Today, we are talking to a board-certified dermatologist about skin health as it relates to food as medicine. Welcome, everyone. Welcome to Care Nation TV Health. We are excited today. We have an esteemed professional with us, a dermatologist. For our Food is Medicine series, we are continuing to talk about healthy skin. And today we have Dr. Ife Rodney. Welcome, Dr. Rodney.
Thank you so much for having me. I'm so excited to be here.
Yes, I'm so excited to have you too. I love how we just met for a moment, and here we are today. We are movers and shakers, I think. I'm not touting myself, but I think we are moving, powerful women. What do you think?
Definitely.
Yes. So Dr. Ife Rodney is a board-certified dermatologist and dermatopathologist. She went to undergraduate studies at Howard University, like me. Also dermatology residency at Howard University Hospital. She continued her training in a fellowship at Johns Hopkins University School of Medicine, where she did dermatopathology, which is the focus of the diagnosis and treatment of skin cancer. Dr. Rodney also has training in aesthetics, and she does dermatologic surgery, focusing on hair and laser treatments. And she is the founding director of Eternal Dermatology in Fulton, Maryland. And we have something in common. We are both Trinis, Trinidadians. Yes, welcome, Dr. Rodney, to all your Caribbean people here on Carib Nation. Welcome. Thank you. What does your name mean? I love this name, Ife.
It's actually Yoruba from Nigeria, and it means love. Although I'm a Trini, I hold on to my African roots.
Wonderful. Well, good. I love it. Well, we really want to talk about healthy skin. And who doesn't want it? How in general do we care for our skin to get that glow, to get the healthy look?
So what I tell all of my patients as the first rule, simplicity is key. Simplicity and consistency, actually. Mm-hmm. So what you want to do is get a simple, easy skincare routine that you can consistently practice every single day, twice a day. Mm-hmm. I recommend starting with just a gentle cleanser, free of strong, harsh active ingredients, no scrubs or anything like that. Just a gentle cleanser twice a day. A moisturizer with sunscreen is key. And I really have to emphasize this because darker skin types, or even all skin types, some people think they don't need sunscreen or they don't need it at certain times of the year, or if it's cloudy or raining. And the key is, regardless of what geographic region you're in or of your skin type, sunscreen is absolutely necessary because the harmful rays of the sun can penetrate clouds, the snow, rain. If you're at the beach, they can multiply by being scattered in a bunch of different directions. And even my brown skin, yes, I'm more protected from skin cancer than, let's say, someone with less melanin, but everyone is at risk. So that's super important to know. And aside from the actual skin cancer risk, exposure to sunlight over time can lead to fine lines and wrinkles and signs of aging. And we all want to look, as youthful as possible. So that's an additional reason to wear your sunscreen every day.
Oh, thank you for telling us that. We're all combating. We're all fighting that. So the sunscreen is for everybody, every color. And we have to remember that, okay, everybody? So within the context of our Food is Medicine series, can you tell us if there are any specific diets or specific foods that really help improve our skin?
So, this is a real point of controversy, and there's been essentially a lot of back and forth about it. So, in terms of the data that's out there, we don't have an actual consensus yet, but some of the guidelines may be leaning towards a diet rich in fruit, vegetables, lean meat, and low in fats, sugars, and overly refined foods. So that's for healthy living altogether, but yes, it helps your skin as well.
So are you saying low in healthy fats, low in certain types of fats?
Well, I like to say generally a low fat diet because not everyone can really discern what's a healthy fat or what's a
Yeah,
bad.
that's true.
Um,
That's true.
so you want to stay away from the fried foods or, certain desserts that is just drenched in oil and fat and butter. Okay.
Yes.
But if you want to separate the types of fats,
Mhm.
the omega-6 fatty acids, we don't love those, too much, and we like the omega-3s. So if you have a choice, that's the
Okay.
balance to go for.
Okay, so we get like the omega-3s are like avocado or olive
Yeah,
oil. I see.
exactly.
I see. So that leads right into my next question. A lot of myths out there about certain foods that you definitely have to stay away from to keep away from acne or just oily looking skin. So can we go through some of those
Yeah,
things that
definitely.
I have a little list. And people are saying, especially like my favorite is number one, chocolate. They say chocolate is all bad. And with the new data out here saying that darker chocolates are cardioprotective, what do you think about chocolate? Because I need to eat the chocolate.
So it just gets a bad reputation for no reason. Okay.
Really?
Again, the data is not 100% set in stone, and they say that foods that are high in fat and also dairy and high in sugar could potentially trigger acne, and chocolate kind of falls into all of those categories. But what's interesting when you look at the studies that have been done,
Mhm.
they're saying that not that if you eat chocolate you'll get worse acne, but just that people that have acne report also eating chocolate. Does it
Okay.
mean that
Okay.
chocolate causes acne? We don't have anything to basically prove that at this point. So what I tell all of my patients, this is really key, medicine is not an exact science and everyone's body is so
True.
different.
Mhm.
So if every time you eat a piece of chocolate, you break out, then chocolate may not be for you. But it's not a reason either to totally eliminate chocolate from your diet in the hopes of preventing acne or curing the acne that you do have.
I see. Okay, so I can have it because it does not break me out. So I can have it. Now, thank you. Now, you did say greasy foods. So greasy foods was another one. Many people say greasy foods can cause oiliness, acne, and so it does.
Well, not
For
exactly.
everybody?
It doesn't directly translate. I think the myth originated because, I mean, you see the oil and you see the grease in the food, and then you eat it and you feel like that's what's coming out onto your skin. But that's not the case. I sort of group the greasy foods and the sugary foods and the dairy products together. And the way that we think they may contribute to acne is because they ultimately increase your blood sugar levels, which
Mm-hmm.
insulin formation, that's the hormone that your body uses to take care of all the sugar in your blood. And then insulin causes hormone production, specifically androgens, okay,
Mm-hmm.
which trigger oil production on your skin and cell turnover and clogged pores. So that's the mechanism by which all of these foods we think may contribute to acne. But again, it doesn't mean that it contributes in every single person or it'll give you severe acne. So you just have to see how it interacts in your specific case and then take it from there.
True. So we do have a lot of concern with insulin and the high levels of insulin in the body, which is
Yeah.
considered a person to be insulin resistant and type 2 diabetic. And we have a lot of people suffering with that. And not all of them have acne, but many who, I'm sure many do have
Exactly.
that. As you said, you're very true. Some have the most glowy skin, but
Mhm.
some people do not. So again, going back to now, how about dairy? We just touched on that a little bit. Now they say all dairy can cause skin problems. And a lot of people avoid it, such as your vegan, vegetarians, plant-based, because they say, oh, it flares up their eczema, things like that. But for acne, I haven't really seen for sure if does that really do something for acne?
Again, we don't have the set data, but just like with eczema, eczema is an inflammatory condition of the skin. There's inflammation. And with acne, there's inflammation as well. So while we don't think that dairy, just directly causes acne, we do know that it can increase the inflammatory state in your body or increase the inflammation in your body as a whole, which can contribute or add to acne or eczema or any other skin conditions.
Thank you. And inflammation is a big culprit we are trying to block because it causes a host of many things. So some people say your diet doesn't affect anything with acne. Is that true? Some people say nothing. It has nothing to do with it.
Let's see. In my heart, I believe that is not true. I believe acne does contribute.
Your diet.
In my heart, in my heart, I believe that is not true. I think that your diet does contribute to acne one way or the other. Is it the only cause or the only reason, or can you cure your acne by changing your diet? No, but I believe that we all have to be mindful and pay close attention to what we eat, even sometimes keep a food log of what we eat and document the changes in our skin that follow and see if we see any associations. And if we do, adjust as needed.
So again, we need to be in tune with ourselves. And that is so important, so important. Now, this one I never heard of, but banana peels that heal acne.
I would have to say no.
No. Okay, yes, that one is a big no-no. So what about raw aloe vera?
Well, so aloe is great in that it helps to soothe the inflammation of your skin. I don't think it's going to help much with acne though, because the root cause of the acne is what we call follicular occlusion. The tiny hair follicles on your skin or your pores become clogged with oily material and bacteria and skin cells. And then this causes backup that leads to the inflammation and redness and scarring, and then the brown spots that result in the end. But applying raw aloe vera, even though it helps to suppress inflammation, it's just not going to be enough to
heal it. Okay. Basically. And now, very popular right now are collagen supplements. People are drinking it, taking supplement pills. They're having bone broth for that collagen to heal the gut or increase their skin plumpness, anti-aging, grow the hair. What else can it do? Oh, grow your nails too. Is that really true?
So my take on it, okay, let me break it down so you all can understand the way I see it. Now, collagen is a protein, and proteins are made of amino acids. When we ingest collagen, just as we ingest chicken or any other type of protein, it gets broken down in our system to the tiniest amino acids, which are then taken into our bloodstream and distributed throughout our bodies. So even though we know collagen is in your skin and it gives it a nice plump appearance, but when you take collagen orally, it's not going to go into your bloodstream as collagen and to your skin as collagen. It's broken down into the amino acids throughout our diet. So I think it's essentially a protein supplement, which is good, but I don't think it's better than any other protein supplement.
Wow, that's big.
Yeah.
Because it is like flying off the shelves and online, everybody's saying use it for menopause, for...
Well, I mean, it sounds good in theory, but when you think of the actual science, not so much.
Well, we have to listen to science. We know about that one, right? Oh my gosh. So I'm going to switch gears to talking about sun and sun exposure because we need vitamin D, and we know that is a very rich source and major source for vitamin D for all of us. But also the sun can damage our skin, as you said, and hopefully not, but it could cause skin cancer. So what is a proper amount of time or exposure that one should get of the sun if they have it, depending on their region, per day?
I would say just a couple minutes a day
Mhm,
is enough. And if you're in the Caribbean, the sunlight is so strong. Even
mhm,
if you're indoors near windows, you're still getting enough sunlight. So there's no need to purposefully go into the sun just in an attempt to get enough vitamin D
okay.
through that way. Also, sometimes people are hesitant to wear sunscreen
Mhm,
because they think, okay, I need some sunlight for my vitamin D intake.
mhm,
And again, that's not true. You should wear your sunscreen. You will still get your vitamin D through, occasional casual sun exposure. And then remember, there are tons of healthy, delicious foods
yeah,
that are rich in vitamin D.
yes,
Okay, and I'm sure you would know even more about
yes,
those. So they're just different ways. You don't have to strictly depend on sunlight.
yes. And I'll mention a few. Those foods would be your richest one source of that is mushrooms, and then anything with your omega-3s, your fish, any kind of fish with the skin. We have to use the skin now. Some people love to take the skin off. The skin has all the money. But those are a few examples. So what are some good products or the latest products that are good for sun protection and protecting the skin and body at this time for kids and adults?
So there's one brand that I love called the Roche Posay, and
Mm.
I'm not sure if it's available in the Caribbean,
Mm.
but what's super important more than the actual brand of the products, it's the active ingredients. So in terms of sunscreen and sun protection, you want a broad spectrum, meaning that it covers both ultraviolet A and B rays, okay, because they can both harm your skin. And a mineral sunscreen is key. I
Mineral.
have totally veered away from recommending any chemical sunscreens. And the way you can tell the difference, the
Mhm.
mineral sunscreens have zinc oxide or titanium dioxide as the active ingredients,
Mhm.
whereas the chemical sunscreens have avobenzone and a bunch of other products.
Mm.
And the key is the chemical sunscreens, they absorb the heat energy into the skin and they can also cause an allergic reaction in the skin at times. Versus the mineral sunscreens are more like a mirror. So they reflect
Okay.
the upper rays of the light away from your skin.
So are the mineral sunscreens the ones that sometimes when you put it, like you make your face look white?
Well, yes, but as sunscreens have been evolving more recently, many of the mineral sunscreens go on very elegantly without leaving that whitish film, even on darker skin types. So I think
Mhm.
that issue of the white cast is
Mhm.
not even going to be an issue at all.
And is there a way, if that's the only one you can get, is there a way to minimize that or?
Not so much. If some of them just have that chalky appearance, and if that's all you can get, I guess you can put some foundation on
Put your
over
makeup on top?
that
Yeah,
can match more your complexion. That would be the
or a
best.
tinted one.
Yeah, definitely.
Mhm. Oh, okay, I like that. Oh, that sounds amazing. So mineral sunscreen, everybody. And again, are the specific toxins that we should avoid from any of these? Because I've heard people talking about that natural versus chemical sunscreen.
In terms of sunscreens,
Mhm.
well, just the not really toxins, but again, some of the chemical active ingredients like the avobenzone,
Okay.
oxybenzone.
Hmm.
There was some controversy about them being potentially harmful, so we just sort of veered away from that direction. There was a recent issue though, where many skincare products had to be recalled because one of the propellants in the spray cans had some potentially cancer causing agents. So just for the near future, I recommend, not doing the spray sunscreens or the spray lotions just until that issue is sorted out and just stick with the creams that you squeeze from the tube.
Oh, thank you. I didn't know about that. So I have another question.
Okay.
I'm a pediatrician and my practice is trusted medical services. And I see a lot of preteens and teens with acne. And many times the parents, I usually bring it up because they're not worried about it. But if I ask, the kids they're like so thankful that I did because everybody thinks sometimes they're like, oh, it's just acne. She's gonna grow out of it. We're not worried about that. and they're not worried about it. But I bring it up and I push, let's try something. And if they say no, they just say, oh, it'll go away. We already have something. I hear that a lot. And then when I say, well, I really think she should go to a dermatologist. Oh, it's going to cost so much money. But I'm like, this is very important. I actually spend time to counsel when I see certain things happening. So can you explain or give some guidelines to families and parents? What are signs that, oh, your child needs to go to a dermatologist ASAP?
Okay, so there are a few very effective over-the-counter acne medications. One of them specifically is the adapalene gel.
Mhm,
That used
mhm,
to be prescription only, but now it's the lower strength is available over the counter. So if you try over-the-counter acne medications, specifically the adapalene, or if you try some including like benzoyl peroxide or salicylic acid as well, and they're not able to control your child's acne, then there's
mhm,
no reason to delay. You should just go straight to a dermatologist, because acne has been linked to depression, low
mhm.
self-esteem, poor
Yes,
performance in school. So it's such a simple fix
yes,
that your child shouldn't really have to suffer, quote unquote.
yes. And this depression and mental health is something we want to prevent in every cause, and it comes in every way. So I'm glad you brought that up because it's something we've been suffering with. A lot of my teens, especially and college students who couldn't go and did the virtual studies, and they just weren't having it. So I'm very thankful that with dermatology, acne could compound whatever else you're going through. And so definitely a dermatologist is something definitely needed for that. So do you think anything, oh, you should tell us about your place. I forgot to ask.
Okay,
Eternal Dermatology. Can you tell us about it?
so Eternal Dermatology and Aesthetics, we were founded in 2018.
Mm,
And we started in a temporary location in Glendale, Maryland. And then in July 2019, we moved to a permanent location in Fulton,
mm,
which is basically right between Baltimore and Washington, D.C. So,
mm,
we serve the whole DMV area.
mm,
Another thing that's really awesome about our clinic is that we have telemedicine. So we do virtual visits, which is essentially like a Zoom call like
mhm,
this. And when you mentioned the college students a few minutes ago, that's what I was thinking about. We have a lot of college students that, are my patients, but they go away to school,
mhm,
etc. I also have a large international following. So patients that can't always fly in to see me, I see them virtually, and we're able to control many skin conditions with just some simple
mhm.
prescriptions over the phone.
Oh, I love that. So, how do people find you at this time?
So you can follow us on Instagram at Eternal Derm. And
Mhm.
we also have tons of information on our website, www.eternaldermatology.com. And I actually have a blog on diet and acne that I
Oh
think
my God.
everyone should read. Yeah, it summarizes a lot of the things we spoke about today with a little more information as well.
Oh, wonderful. I love it. And so, what about the telemedicine? How do what countries do you serve, or is it just in general?
Yeah, we serve the entire world.
Wonderful. Yes. You
Yeah,
got okay.
it's
You have to call Dr. Rodney. This is this time I am always on telehealth visits myself, and I love it because we had a problem with access before, and
yeah.
there's no problem with access anymore. Televisits are very reasonable and actually lower cost than a doctor's visit, and you get a lot of expertise for a shorter amount of time. And well, what else can you say? It's really good. It's not going anywhere. That was one of the COVID benefits for healthcare, and it changed healthcare in so many ways, don't you think?
Yeah, definitely.
Yes,
It brought
definitely.
access to so many people that couldn't, get it before. So
Yes,
it's wonderful.
access is everything. So I am so thankful. We went through everything. I'm so thankful that you were here today. I know our viewers learned a lot. You gave a lot of high-powered information. And Dr. Rani, please come back We're going to have you back another time. Our Trinbagonian sister, thank you so much. And Carib Nation viewers are loving you right now, and they're going to come looking for you. Again, so thank you.
Thank you.
Well, once again, I want to thank everyone, Carib Nation TV Health viewers, for watching today. We've really learned a lot about dermatology in relation to food as medicine for our skin health. I'm Dr. Lisa Boyne-Sindas, and I am so thankful to be part of this. Until next time, please remember our motto here at Carib Nation TV. We are one people, we are one culture, we are one Caribbean, and we are one nation. Have a wonderful, blessed day.